Zoom recording. All right. Hello, Bill.
Hi there, how's it going?
Fine, how about you?
I'm doing good.
How's Pismo?
It's pretty good. It's pretty good. Yeah, we just got out here just a little while ago, but it's looking good. It's a little chilly out here, but it's super nice.
Good.
So beautiful. Yeah. Not 529. 529. All right, Bill, you can start this if you'd like.
Awesome. Well, we'll go ahead and call this a strategic planning committee meeting to order. Do we want to go ahead and do a roll call?
Director Leach,
Present.
Director Mraz.
Present?
Thank you.
Awesome. Do we have any public comments?
We do not. I received nothing via email and we have no one else in Zoom with us.
Awesome. Well, seeing none, we'll go ahead and close that portion of the meeting. Move on to the discussion items. Item A is the mission statement. In the last meeting, Director Mraz expressed interest in kind of looking at this. So that's kind of the genesis of this item. And Director Mraz, if you have anything to go with as we start the discussion item, we kind of go from there.
Well, it was just a thought for consideration that as we're growing and things have changed so drastically from when we initially had our mission statement, it might be something for the board to consider whether we would like to look at our existing mission statement and perhaps again, agree and keep it as is, or perhaps augment it to what we're dealing with in our current stage of development with the Wellness Center.
Okay. Do we have a current iteration of the mission statement that somebody can read, please?
Yeah, the current mission statement is the Fallbrook Regional Health District assists residents to lead healthy lives, supporting a greater lifespan and independence. And I think strategic planning put this forward, I believe, in 2020.
Okay.
So the question really becomes whether or not you all want to change it to adapt to some other language, or whether or not you want to kick it down the road for a later conversation, or because typically the strategic planning would draft something and then take it to the board for more consideration.
Okay. Barb, did you have something, or did you have, maybe something you'd like to add or subtract from that?
I was thinking about maybe revisiting it and encompassing the fact that we are working with the development of a wellness center for the needs of the community. And in doing so, we are providing, programs to address maybe the health issues, or, the 5 big ones, or maybe something just generic. It was just something to be more encompassing, to show that there is a specific agenda that we have, because to me, the mission statement appeared at this point in time to be rather generic. I'd like it to have a little more specification about the efforts of the district to provide information and education and a wellness center for programs that would help empower the community to lead healthier lives, etc. Something along those lines. That's where I was going with my frame of thought.
Well, Bill, if you'll allow me, I will say that the vision statement, it might be that the vision statement is closer to what you're thinking, because that is the Fallbrook Regional Health District will offer and support services and programs that measurably improve physical and mental health, social engagement, and increased lifespan and independence. Is that closer to how you?
Yes, and would we need to make any reference to the JPA or collaboration with the JPA with the North County Fire?
I wouldn't think so, because that is just one of the programs, so that's like underneath it,
Okay.
but that's completely up to you all.
What are your thoughts, Bill?
Well, I wouldn't want to really add anything in there about the JPA just because
Okay.
that's kind of like a year to year sort of budget item or whatever. But have you taken a look at the page? Because I'm looking at it now too, is because I'm not sure how it came to this, but now at this point we have a mission statement, a vision, and values. So there's quite a bit of discussion as far as the mission of the district. Barbara, did you want to just a thought, but I don't know if you want to maybe go back and write something or come up with something that you think would be a better wording of it, and we can kind of discuss it at the next meeting.
I'll take that advisement and take a look at it again and see if I think it needs to be punched up a little or if I'm in agreement with it.
Yeah, I mean, I would be good if you maybe just take a look at that whole page that's like the vision, values. I don't know exactly what the wording is. Mission, vision, values page on the website, and then just maybe just take a red pen and just kind of figure out like what kind of works on that and what doesn't for you.
Okay.
Maybe kind of discuss that a little bit more at the next strategic planning committee. And if
Okay.
we come up with something better, we can shoot it to the next to the next meeting. I mean, I agree. It's kind of vague, some of that stuff. I mean, if we can kind of get a little bit more specific, but I would just kind of be careful about getting maybe too specific. I'd hate to have like in our mission statement, something like, we support the JPA and then the next year's budget, us decide, oh, we're not going to support the JPA.
Right. I understand.
Kind of switch it all around or whatever, but I'm certainly open to you kind of wordsmithing that a little bit and kind of mess.
Okay, I'll do that.
So
Thank
you'll
you.
find this all on the district's main homepage. You can click to that. And it'll give you all three of those pages that Bill just mentioned.
Yeah, maybe if somebody could print that off for Barbara and give her a copy, that'd probably be easier. I don't know if you guys can do that, and then Barbara, if you just kind of go through that, and we'll just kind of discuss at the next.
Okay. Very good. Thank you.
For sure. Okay, fair enough. So next item we have is the PACE program item that was it was kind of a discussion point at I believe our last committee meeting. Rachel, do you have anything to add to that? I just kind of wanted to put it on the agenda to get an update and see if we have anything else on that. Or
I met with the PACE folks and let them know that strategic planning gave an initial kind of, we're interested. They're going to go back and put together a little bit of rough numbers from their side to find out and make sure that it would be viable. And then we could talk about what lease space would look like, what cost we would put on that, and kind of go that next level of negotiation. But at this point, I'm waiting for them to return back to me with a little more information that they needed. But we gave them the initial, the district is interested in this level partnership with what they outlined from that first white paper that I gave you all. And then from a facility standpoint, we discussed from that special meeting that classroom 3 and 6, the end of the building, could be the ideal place to house them. So we're still working with that same basic information.
okay. Barbara, do you have anything on that or?
No, I think that based on what we talked about today with our in our facilities committee, there's a number of things that we're looking at moving forward with, and there's looking at March. Was it March? We're looking at probably the end of that first portion of some of the items we discussed, like for building 1 and 4.
For rooms 1 and 4, but that wouldn't impact what PACE needs. But yeah, that's where we anticipate those 2 rooms being done.
Right. I don't know that there's a timeline that they want to initially jump in. Did they state that they?
That's what I'm waiting for. from
Okay,
them.
okay.
Yeah.
I think this is to be continued until we get more information
Okay.
and let them know that we are interested. We just need more details so that we can take it under consideration, but it does sound like a promising program.
Yeah. Yeah. Well, I would just kind of, just with the last regular board meeting and the special meeting, it definitely seems like there's a desire from the board to kind of maybe get something clinical, some sort of clinical services, or partner with some sort of groups, or that can utilize, I guess, that room 3 and 6 area. I think it's kind of well designed already for something kind of like that. So, you know, any updates we could have on that, we definitely be looking to, move forward with something like that, or, any other sort of programs that you come across out there. So, Barbara, do you have anything else to add, or you're good on that one?
No, I'm good on that. I'm
Okay.
good with that.
Okay, so the last discussion item we have here, it just says community collaborations. I kind of just asked for that to get thrown on there, just because one of the big things I think that we can do as a district a little bit better is kind of collaborate with more other community groups, and kind of work on some joint projects and some more collaborative efforts on some things. So I just wanted to kind of put that on there as a discussion item. I don't have anything specific or any ideas specific, but I would look to Rachel and staff to kind of continue to develop that. It seems like we're kind of moving in the right direction with some of that, but I think that the more we collaborate with groups, I think we kind of fight off some of that talk that's like, hey, we're competing with different companies or groups, and it kind of heads off a lot of that duplication of service that we've definitely heard about. So, Barbara, I don't know if you have anything to add to that, but that's kind of my piece on that.
I think that our community collaborations have improved significantly in the last couple of years, even in spite of the COVID. We have a really good response in the community. There's more awareness. I think that the one thing that we might want to consider for the future is the feedback that we're getting about this concern about not having an urgent care or some kind of a clinical facility. And I think, as we discussed, having a narrative on our website that tells the community how we got from having a hospital to where we are now, and the fact that the urgent care has been supported by the district for a considerable period of time, but that we don't really know where the future is going to go with that. And we also need to remind our community members that their insurance programs will usually direct them to an urgent care, and oftentimes it's not the one that's here in town. It's the one that's within their health plan. So I don't know how we can, we really can't make the community happy by saying we're going to give them an urgent care. We have an urgent care. We have been working diligently to help the community have an urgent care here, but it's one of those things that's going to be a complex issue. We might find the urgent care relationship that we have currently, it may turn into something more significant, or we may find ourselves starting back at square one. We don't know. It's one of those big question marks, and I'm just kind of hoping we can look a little bit into our future plans to see how we might work on that component for the community. There's no definite answer. I mean, we can't provide a clinic. We don't have a license to have an urgent care. Rachel made a comment about, it's too bad that our current tenant in that building is not interested in becoming a not-for-profit. And maybe if they knew that that could be a benefit to them, perhaps they might want to talk about that in the future. Especially if we had a program, something like PACE, that might look at having a physician interaction and might help him feel a little more grounded. Maybe there might be some future there. I don't have the answer to that, but I'm just kind of hoping to keep the community calm about the fact that, you know, we've tried as hard as we possibly could to keep an urgent care open in this community. And it was a rough go, and we're very fortunate to have what we have currently. I would just like to be able to see that improve if we can, or if not, be prepared to have things take a different direction and, you know, decide what we might want to do in the event of that.
Well, and Bill, I'll add, if you don't mind,
No, go right ahead.
building on what Barbara said. I've spoken with Director Stanisek, and we'll bring forward to governmental and public engagement a conversation about doing some public forums again, so that we can at least try to remind folks of the efforts that you all did back in the time about urgent care. I started working today on a simplified timeline infographic of where we were and how we got to where we are, with some of that information. So I'm still working on those things that came out of that meeting. As far as collaborations with community partners, I know Teresa is working obviously with lots of different folks. I had a conversation with a grantee today about a potential partnership. Once I have a little bit more information from that conversation, I can try and bring that forward. But we are continuing to look for potential programs that fit within the overall framework that was identified. I did put on the board portal, and it's in our minutes from last October, the overall strategic plan that was outlined for this year. So we're still plugging away at all of that. Teresa's got probably the biggest list of partners. And so we're moving forward with that. But we'll put a little bit more emphasis on some of the awareness and outreach piece. And Bill, obviously, as being a member on that committee, you'll hear more of that next week. Yeah.
Yeah, but in closing, I would again reiterate, the community collaborative has grown significantly in the time that I've been on the board. The outreach is phenomenal. The recognition and the webpage is just terrific with all the information, the programs that are listed. And I'm getting feedback from the members at the staff at the wellness center that the community is aware that we're there and they're interacting more. So those are positive things. So I'd like to just keep that positive momentum going, you know, and just be sensitive to the fact that we're all aware that the urgent care is an issue, has been. It's kind of like transportation. It's kind of one of those things lurking in the background. And we're doing the very best that we can at the present time.
Okay. Yeah, no, I agree. I think that we're definitely moving in the right direction. I think that the facility there at the wellness center definitely kind of helps facilitate collaboration with groups when they're already over there utilizing the facility, or we're doing something with them over there. But like I said, kind of leave this on the agenda here as a kind of ongoing conversation to kind of continue to collaborate with other groups. I mean, one big group I'd like to see us do more with is the school districts. It'd be nice to, you know, kind of partner with them a little bit more. I know they're kind of doing their own thing, but there's definitely a lot of kids that we can help, and a lot of people and younger families that we kind of get into our programs and to our facilities and kind of get them there. So, you know, I think Teresa's doing a great job with all of that, and Rachel's doing an amazing job with all that as well. So, you know, kind of continuing that, and, you know, hopefully, you know, we'll continue those discussions. Just on the public relations note, I just wanted to mention, I thought that the at least the Facebook seems like there's a lot more posts. I've noticed a lot more of the pictures. I saw something with Rachel on there the other day, you know, so it's nice to see some of that stuff. And I think some of that stuff is going to, you know, continue to help us with momentum with that. I actually talked to a reporter for the Village News on Saturday as well. He had a lot of questions about you know, the last couple meetings. So I'm hoping that, you know, I answered all of his questions. And then if he puts something out in the newspaper, it'll have, you know, more facts and people can kind of see like what we're doing and what our intent is for that facility. So does anybody have anything else on C?
If I may, with regard to community collaborations, in our meeting today on facilities, it was recommended by Mr. Musa, as we make our improvements on the wellness center, that we should take before and after pictures. In other words, if we need to redo the bathrooms or we need to do the kitchen or whatever, show the existing condition that warrants the upgrade, and then the after completion of the upgrade, so that it's all justifiable, so that there's no question about why we did what we did, because it was needed. We're not just going to arbitrarily just, redo everything, but those things that need attention are being addressed, and to justify our moving forward for those improvements. Mr. Musa did recommend that we take photos and have, before and afters, and maybe it would be a good thing to put some of those in a blurb on Facebook, like what's happening, or we could just put it on the website. Whatever way we decide to do it, it would be something that would be beneficial to help the community understand we're moving from this, and the improvement will be hopefully this, and then our finished product.
Yeah, that sounds like a great idea. I think as we go through, we're definitely improving a lot of things, and obviously not everybody has been to the facility and seen what it looked like when we first purchased it, and so I think that's a great idea. It's a good piece on that.
Do you think that any kind of a like, I don't want to say open house, because that kind of denotes that we were closed and now we're open, or but maybe a spring type of a event, some kind of event?
The public forums that I mentioned, I expect that I would hold over there.
Okay,
Yeah, so that would kind of fit along that, not open house,
yeah,
but allow people to be on to the site and see where some of the other changes are. Yeah.
okay.
I think that would be a great idea. Maybe we can kind of walk around and kind of see what's going on. Maybe some people put their email addresses down and get on the list and kind of see what's going on or whatever. But yeah, that'd be great. I think that'd definitely be a big piece. And if we can kind of get that, obviously we'll go through the public relations committee with that, but kind of get that on the newspaper and kind of get people out. It'd be good to kind of see people using the facility. And I think we've definitely had people out there before, but I think the amount of programming that we're offering right now, if we get people in, I think it's likely that some of those people will kind of stick with some of the stuff that we're doing. So good idea.
Okay.
Anything else on C?
Not for me.
I don't know. Is it appropriate? Can I say something, or am I inserting myself where I'm not don't belong?
No, ma'am, you're fine. You can make comments here. That'd be fine. If you could just introduce yourself and
Absolutely. Thank you, Bill. My name is Lisa Turner. I'm the executive director of Palomar Family Counseling Service, and I just wanted to point out the community collaborative has been a real, I think it's been a really positive thing for the health district, and you should be very, proud of the work that comes out of that. It's really good energy. Teresa's done a great job, I think, of stepping that up, and I think people feel really engaged. But as a community partner, they're really super helpful meetings, and I myself don't go to every one. I've been to many, but I haven't been in the last 2 months. But I will tell you though, they are really helpful. We really learn from each other, and it's helped me to become more aware myself, is not just what other grantees, community contract or community grantees are doing, but just other organizations in the community that I might not know of otherwise, since like me personally, I'm in Escondido a lot of the time. So those are really, it's just such a valuable, and I know we've been having those meetings forever, and they've gone on for years, but they just have a whole new energy now that's been really, really great. And also, just as a grantee, just wanted to say, always express thanks for the support of the health district to help us run our programs.
Awesome. Well, thank you, and we appreciate you attending the meeting. I mean, it's always great to hear people's input and have people participate. And I agree. I think that collaborative, it's a great group, and we're glad to kind of be a part of that and kind of move that forward. So looking forward to continuing to collaborate with groups like yours and seeing more people utilize that facility, because I think when we build it out, and the more options we kind of have, the more services we'll be able to kind of promote.
Thanks.
All righty. Well, we're going to close C. And number 4, we have board member comments and future agenda items. Barbara, I'll let you go first if you have anything.
I think that we are on the mark with moving forward to complete certain upgrades in different areas in the wellness center. I think the momentum is really great. I think it's terrific that we are so busy over there. I hope that the wellness center will be able to be continued in a format of being a resource to Lisa and other of our grant recipients for the programs that we have that may help within their special purview. So I'm just very glad that we're getting the word out, and it's a matter of all connecting the dots and everybody being supportive of what's going on, because we're trying to get out from underneath that lockdown mentality that we had from the COVID, and moving out. People want to get out and do things and know what's happening and become more engaged in what is happening within the community. So I just hope we can keep up the momentum. And I think that now that we're going into the grant season, we'll see a little more activity and maybe have more presentations from some of our grant recipients about the programs. And I'm just very proud of where the community's been from where it was to where it is now. And in the light of the fact that we do not have a hospital, I think we're doing a very good job of reaching out and putting the information into the community's hands so that they can be empowered to make healthy choices and decisions regarding their own health and the health of their families, because healthy families make a healthy community.
Awesome. I agree with that. Thank you, Barbara. So I just have a couple, I guess, future agenda items. The first one is I'd like to start crafting the next annual strategic plan. So strategic plan 2024, kind of looking at what the district is going to be looking like at that point, and we can kind of start brainstorming some of what we need to do to get to that point. So maybe we can kind of start on that in the next committee meeting. And Barbara, if you can kind of start, I guess kind of start thinking about like what your ideas are and where you kind of see the district as a whole at that point. Maybe take a look at the 23 version, and we can kind of go off of that and kind of continue that. And then the other item that I'd like to kind of start discussing is that urgent care building. So I think that we're kind of at a point where we're not really sure what's going to happen with that. I guess maybe the assumption is that that they're going to complete the sale and they're going to, and we're going to kind of be done with that. But, I'd like to kind of start discussing like what the plan is if they don't have the money for the note, or if there's any other contingencies. I want to kind of start the discussion on what we're going to do with that, if that's the case. Rachel, I'm not sure if you've talked to Dr. Skio at all since the last time we've spoke, but I don't know if it's possible to get maybe a read on him if we need to kind of plan a plan B, or if you have any idea kind of where we're going with that. But if there's any sort of possibility that, we might get that building bounced back to us, I think that we should probably start thinking about what the plan's going to be right now before it happens. So,
Bill, I believe that you'll have a closed session, and update from Jeff at the next board meeting on that particular topic.
is that right? Okay, awesome. Alrighty, well, if that's the case, I guess we definitely won't need it on a future committee meeting agenda. And if for some reason that doesn't go through or something happens with that, I'll just kind of throw it back on there.
Okay.
Awesome. Well, that's it for me. I appreciate the staff getting everything together and making it easy for me to run the meeting with Zoom. So I appreciate you guys being patient with everything with technology and whatnot, but good deal, went good. So hope everybody has a good rest of your week, and look forward to seeing you guys at the next meeting.
Great. So we're adjourned right at 6 o'clock.
All right. Thanks a lot.
There you go.
Later.
Good
Bye.
night.
All right. Enjoy your vacation, Bill.
Oh, I will. Good stuff. See you later.
All right. Bye.
Good night, everyone.
Thank you.
You know, I'm wondering,